Alright team, here are the symptoms we're looking at today. Hidradenitis suppurativa, rheumatic fever, and orbital sphingolipid biosynthesis regulator 3.
Those are quite a mix of symptoms. It could be a number of different conditions.
I agree. We need to consider all possibilities before making a diagnosis.
I'm leaning towards rheumatic fever based on the symptoms presented.
No. It's not rheumatic fever. It's pentasemy X.
Pentasemy X. That's a rare genetic disorder. Are you sure, Hawks?
Damn it, I'm sure. And we don't have time to waste. We need to perform transoral robotic surgery immediately.
But that surgery is extremely risky, Hawks. Are you sure it's the right course of action?
I didn't come this far to second guess myself, Kelly. Get ready for surgery, all of you. This patient's life is in our hands. Tracy, I need to talk to you about the patient in room 302. I strongly believe she has pentasemy X, and I want to perform transoral robotic surgery on her.
That's a very risky procedure. Are you sure about this? Have you consulted with the specialists?
I don't need to consult anyone, Tracy. I have years of experience in this field. I know what I'm doing.
Hawks, I understand your confidence, but we need to proceed with caution. Pentasemy X is a rare condition and we can't afford any mistakes.
You don't get it, Tracy. This patient needs this surgery, and I am the best person to do it. Stop questioning my expertise and let me save this life.
Hawks, I respect your skills, but you have to understand the risks involved. Let's discuss this further before making any decision.
Oh, no, this is not good. The patient is in critical condition after the surgery. How am I going to tell Hawks that the transoral robotic surgery was not the right treatment for pentasemy X? I should have known better than to try this experimental procedure without sufficient data.
What the hell were you thinking? You nearly killed our patient with that botched transoral robotic surgery and misdiagnosis.
But sir, we followed the procedure to the T. The diagnosis was just tricky.
I still think it was a case of postoperative complications, not something we overlooked.
No, it was clearly a surgical error during the procedure. We need to be more careful next time.
Careful? You call that careful? You're all a bunch of incompetent fools. I can't believe I trusted you with this surgery.
We were just trying our best, Dr. Hawks.
Your best almost cost us a life today. I'm done with all of you. Figure out the correct diagnosis before I even think about letting you touch another patient. I'm out of here. Shocks, storms out of the room. I can't believe I still haven't figured out what's wrong with this patient.
Maybe you should try looking at their blood work again, or perhaps consider a different diagnosis altogether.
Thanks for the suggestions, but I think I know what I'm doing.
Well, it doesn't seem like it.
Wait a minute. I got it. The patient has a rare form of autoimmune disease. I need to go check on them right away.
Hey, where are you going? You can't just leave like that.
I need everyone's attention. Forget pentasemy X. We're dealing with nail patella syndrome here.
What are you doing, Hawks? You can't just barge in here without proper equipment.
This is outrageous. We have protocols for a reason, Hawks.
I can't believe this. We have a patient on the table, Hawks. Focus on getting the right diagnosis.
Trust me, I know what I'm doing. This is nail patella syndrome, and we need to act fast. Tracy, I finally found the right diagnosis for the patient.
Congratulations, Hawks. But remember, the wrong diagnosis nearly cost the patient's life.
If you had just listened in the first place, we wouldn't have gone through all this.
I listened to you, Hawks. But sometimes we need to consider all possibilities.
All possibilities? You were adamant about your diagnosis, Tracy.
And you were too stubborn to consider other options, Hawks.
Well, next time, how about we try listening to each other instead of arguing like this?